And we're recording now. Hi, this is Bill, the knee pain guru, and with us today is Carol. Carol has been working with the Quit Your Quack program for how long?
Over a month.
It's been
going on 5. I'm coming up on my 5th week, or I'm in my 5th week.
In your 5th week. And how'd you find me? Like, how did that work for you?
That's a good question. I don't remember. I really don't. Oh, I'm sure through a YouTube video, looking for, probably looking for some type of stretches for that like the tendonitis right, like above the knee. I think that's somehow like quadricep tendonitis. So I think, looking back, I think that's how I found you. Like, so, one of your videos popped up when I searched that.
Mm-hmm. And like, what were you dealing with? What was your diagnosis?
So I did not go to a doctor this time, this go round, but I've had, like 9.5 years ago, I had surgery on my right knee. A lot of surgery where I was on crutches before the surgery and then continued on crutches for 2 months after the surgery. So I had a lateral release, a meniscus repair, and microfracture, which was the big one. The big one was the microfracture, and I couldn't touch down. With the microfracture, I couldn't touch down for the full 2 months.
So that was 3 different surgeries you had.
In one, yeah, in one shot.
So it was,
all at once.
They did 3: the lateral release, the meniscus surgery, and the microfracture, like all at the same, like when they put you out, that's what happened.
Yeah, it was all done at once. So in other words, it was a lot of surgery at once.
Got it. And that was 9 years ago.
Yeah.
And what's been going on ever since that kind of led you to the level of pain that you've been working with?
Right. So then, after that, it was 2 years to get back on the tennis court. Like I could, even a year after, I couldn't run. I just didn't have it, like that. I lost, a lot of muscle strength, whatever you want to say, but it was strength. So it took me that long to get back. And then I was okay, playing tennis and doing what I wanted to do. I always felt like that right leg was not as strong. There was an imbalance, right? Mm-hmm. So then 2.5 years ago, I had back surgery. All again, right side problem, right side. And I had drop foot, right side drop foot. I had some steroid injections which helped, but didn't resolve the drop foot fully. So I had the surgery. And then that was 2.5 years ago.
Mm-hmm. And so you've been going to physical therapy. What's been happening over the past couple years?
Right. So after the knee surgery, I had physical therapy, and then after the microdiscectomy, the back surgery, I also had physical therapy, and both times, got me stronger, better. But in particular, this time it did not address all issues. Like I healed, I got, I got stronger again. I worked on my quads, worked on my legs, all that to get back to a point. But there was a lot of imbalance as a result of becoming out of balance from the surgery, like more out of balance. I was out of balance going into the surgery, more out of balance coming out of the surgery, and coming out of physical therapy too. Like, hip problems, piriformis problems on the left, while the foot and back problems were on the right. Mm-hmm. And then my knee started bothering me through this process again. Mm-hmm. I remember, maybe a few months after the knee surgery, the protocol was for walking, and I did a lot of walking, and then my knee started bothering me, and I got a steroid injection because I didn't want my knee to stop, that started kicking up. So now and at that point, that's 2 years ago. So I got stronger. I did some strengthening stuff, and I got strong enough to get back on the tennis court. Still had the piriformis issues. Sometimes on the tennis court, like I just would feel like my butt and my quads on my left side, like really burning, like pain, and I was playing through the pain. And then, because I wanted to play tennis, I wanted to get back to what I loved, what I like to do. I wanted to get back to activity. And then after that, my right knee started bothering me. Probably I was compensating, and I kept having these bouts of my knee swelling, and then I would lay off. Then it would feel better, and then I would go back to playing. My knee would swell up, and all that for me, and also calf pain on the right. It was all that compensation. So that's what brought me to you. I said after maybe the third round of this, I said, no, I gotta take care of this. I have to address this. And, I found your program, and you were talking about neurology, and that's what I've been addressing a lot, is the neurology of the pain. And I liked what you had to say. Like, it really came through. What you were saying came through for me, and I wanted to hear more from you. So I scheduled a phone call. In fact, I remember I couldn't even wait for the 4 days for the phone call. So I registered for the first phase, where I got the pain pattern interrupts. And in those few days, I felt like those 12 pain pattern interrupts really helped me.
Great.
And before we even spoke, I liked what I was doing.
Great. And then you got into the Quit Your Quack program, and we started working in the group context, in the Facebook group. What did you notice? Because you had 4 days working with the comfort zone. Then we had a conversation, and you started working with the larger program, the group coaching program. What was your experience in that program? How did it shift and change things for you?
Well, I think back on the beginning of the process, and I think everybody kind of feels this way, that they they're anxious to feel better. They're anxious to get out of pain, and they'll do what they need to do. Like, I was doing all my pain pattern interrupts, and at the same time I wanted more. But then as time went on, I appreciated the process. So, I stuck with the process, and I was happy, once I kind of got through that initial pain, got rid of the swelling, got rid of most of the pain in the knee. Like, I still, at this point, I call it discomfort. I don't call it pain where it was pain. Then we moved on to the strengthening, and we started addressing my hips then, which in turn is addressing my knee and my foot. I think the problem is my hips. My hips. That whole series I've been doing, 7 to 19, I do it every day. And I wasn't feeling well for a few days, and I laid off, and I noticed the difference. Like, ideally I want to do that full series twice a day. It's really helping me. And when I lay off, I feel the difference.
Got it. And what is one of your biggest takeaways from working with the program?
Well, for myself, I had these new pains after my back surgery, like the piriformis, my right foot from the drop foot, and there is some serious pain there. And I thought, well, maybe this is something I have to live with. You know, this is maybe nerve damage or, you know, an imbalance. But I'm chipping away at that, and the pain is decreasing daily. And, you know, every once in a while, like I'll be driving in the car, for instance, and I'll say to myself, wow, that pain that I usually have in my butt when I'm driving is not there anymore. And, you know, that's 2 years of that pain that I was just dealing with it because I thought that's how it had to be, and that's how it was going to be.
What would you share with someone who's considering looking at the program, like looking back on it now after 5 weeks-ish that you've been working with it, that would be really valuable for them to know?
I would say, especially if they're very interested, I would say you have to go all in. It takes some time, and not some time to feel better. You will start feeling better immediately, but you also have to take the time to do what it takes to feel better. You have to, you know, if you're in that immediate kind of critical pain with your knee, you have to do the pain pattern interrupts as needed. You know, maybe you have to dedicate, you know, that first week to really concentrating and learning and knowing what your body and what you have to do and what's going to work with you. And then give Bill the feedback so he could better help you and point you towards more fine-tuned modules and approaches for your particular issues as they develop, because it's a process, and it's everything changes as the days go on, and you start feeling better. Then maybe new issues have presented yourself, like for instance when I got my knee out of pain, well, now that hip pain was pronounced, and now it's time to deal with the hip pain.
Right.
And, you know, you have to want it. You have to go after it. And I also believe that you have to maintain, like, I'm not out of the woods 100%, but I'm so much more out of the woods than I was 5 weeks ago. But I also know that I'm going to have to maintain. I'm going to have to be dedicated to continuing to feel good.
Mm-hmm. Got it. Is there anything else you'd like to share? Anything you would like to add? And we'll wrap it up.
Yeah. Do you have any more questions? I recommend the program. I recommend the program to anyone. I know some people might say, you know, it's not for everyone. But I think it is for everyone. I think if you really want to feel better, if you really want to get out of pain, it is. And who doesn't? You know, that's why I'm saying I think it is for everyone.
Yeah.
What do you think?
Well, what do I think? I think you're right from a physical standpoint. However, some people aren't there. They're like so attached to their pain that they identify with their pain, and they need their pain in order to understand who they are. And they don't know what it's going to look like if they are out of pain. So it's right for everyone on a physical sense. But some people aren't mentally or emotionally ready, because the work does bring up the mental and emotional states that led us into pain to begin with. So not everybody is in that place. They're looking for the drug, the shot, the surgery. Give me the exercise to do and I'll zone out. But this is really about feeling comfort in your body to find your way out of pain. And just for you, like, I'm going to add a little bit of coaching in here, because the maintenance that you're doing right now, we're gaining a habit factor in your life that the level of maintenance you have to do now is more so than it's going to be in another month, in another 3 months. So those 7 through 19 that you're doing every day that makes you feel better, and if you slack off for a couple days, it comes back right away, is only for right now. And as we use that as a tool to understand the larger pattern that's going on in your body, what we'll be able to do is use pain pattern interrupts to release those patterns. So then in a month, couple months, 3 months down the road, we're going to be looking at other stuff. And you're not going to have to be doing so much maintenance on what you're doing today. So there's an evolvement of it to customize the program for you. So this is an ongoing process, but it isn't doing the same thing process. It is, we're working on bigger things. We're working on how it feels in your life and reconnect you with your body and reconnect you with your life in a way so it feels enriching and fulfilling and your quality of life is there as you move on into the future. How are we doing there, Carol?
I do understand that. I probably didn't. Can you hear me?
Yeah, it locked up there just for a second.
Yes, that is how I see it, and I just didn't articulate it as well. But just on that note, you was talking about body awareness, and I thought that my hips were just locked up and that was age and that's just the way it is. But these exercises, like I feel like every little part of my hips into my sacrum and like everything's moving and everything's moving freely. And I don't remember the last time I felt that way. Like, that's really powerful stuff right there. Like that's good stuff. Like, it's pretty amazing.
Tell the yoga story. Remember the other day you were telling me about yoga?
Yeah. That, when it comes to the hip stuff in yoga, and again, that just ties into what I was saying, and I've been practicing yoga at a studio, for over a year, and, lots of improvements, little subtle ones all along. But when it comes to the hip stuff, I'll just, I would always just need props and just feel like, I'm limited in that, especially certain hip movements or openings. And last week I went to yoga and I was like, wow. And for instance, what do we did something, and normally I would think twice and have to get a prop and get myself ready, and I just went down, and I did it, and I said to myself, wow, that's kind of crazy because I have never done that, and I hadn't been going to yoga either. This was me coming back to yoga because I was dedicating myself to your program until I felt ready. And so I hadn't even been going to yoga, and here I am, like, boom, right down on the ground, squatting, no problem.
Nice.
Yeah.
Cool. That's an awesome place to end. I want to thank you so much for taking the time to share your experience with the program, and I would encourage anybody who's watching this, please enroll in the Quit Your Quack program. You will see Carol as well as a whole host of other people that are in different ages, different situations that are struggling with their knees, and the whole idea is to get you feeling better so you can enjoy your life. So, yes. Carol.
And Bill's great. Bill is one. He's the ultimate coach. Highly recommended.
Okay. Thank you, Carol.
Thank you, Bill, for everything.